A remote eye consultation is one that either takes place over the telephone or over a video link. And sometimes we offer this for patients because it's not necessary for them to come to the hospital to have some of the tests we do, like visual field tests or examination under the microscope, that sort of thing. We can just get the information that we need and make sure symptoms haven't changed. Not every patient can have a remote consultation. It's very much only if their condition is suitable for it. For example, we need to see people in hospital if they need visual field testing or imaging, other things which you can only do in hospital. On the other hand, there are patients where we just need to see how therapy is going if they've noticed a vision change. And those patients can be seen very easily by remote consultation, and it saves time travelling to hospital, parking, all the time waiting around in clinic. Much more convenient for the patient if they're suitable for that. We completely understand if a patient would prefer to be having a face-to-face consultation than a remote or telephone conversation. That's completely the patient's choice, and we've never forced a remote consultation on them. It's just that sometimes it can be more convenient for the patient to offer this type of care. One of the things you'll know if you ever come to an eye clinic as a patient is that you get asked to read a letter chart, and that gives us an idea of your eye health, how far down the chart you can read with your glasses. That has always been something that has made us hesitant about offering remote consultations because of the unavailability of doing that at home. But things have changed in that we now have a vision test that we can do online called DigiVis DVA, and we can actually ask you to do that test at home on your own digital devices, and it will give us a very accurate idea of what your visual acuity is. So we have that information when we do the remote consultation. DigiVis DVA is an app that the patient can use to test their vision at home whenever they want in the comfort of their own home to give an accurate result that the clinician can then use to define their treatment going forward. Many patients may worry about the accuracy of a home vision test, but this test that we're using has been developed by clinicians, a lot of clinicians, and been used on a lot of NHS patients already. It's been in clinical use now for a good 3 or 4 years, ever since the COVID pandemic, and it's been tried and tested so that we know that it's accurate. The online app can be used by anyone who is over the age of 4. I understand that some people have limited digital access and may not feel that happy using digital online tests at home, but you can always get support from friends or family to help you out with the test, and we can assure you that once you do the test and you set it up, it will be accurate. If the clinician feels that the patient is suitable to have both the remote consultation and to have the home vision test, they will send the patient the link either through their smartphone or via email, and the patient just clicks on the link and then they can do the test at home. We take data security very seriously indeed, so the app doesn't take any patient data at all. The patient who's doing the test owns their own visual acuity results. It's theirs for them to keep and to share for us for when we do the remote consultation, but no data is shared with any third party. If the patient gets stuck using the app itself, then there's help at hand. In the patient information leaflet that the patient would have been given, there's a technical support number, so the patient can contact that. Also, the other possibility is that the patient might get a bit panicked because when they do the visual test on their smartphone, they will have a result there which will be numbers, which they might not necessarily understand. There should be a remote consultation planned fairly soon after the remote vision test is done, so the clinician will be able to explain what the numbers mean. But if the patient has a bit of a panic, they can also phone up for support from the number and they can be reassured by the clinician.